doctors at Al Jalila Children's Specialty Hospital have reported seeing an increase of incidents involving choking in children, and they're warning parents to take extra care, especially when it comes to the safe storage of items like magnets and batteries. They've reported seeing more than 50 cases of foreign object removals from the airway or digestive tracts of children last year. Another 9 cases so far this year that have been reported. And they've said that mostly small objects, buttons and earrings, will pass through the digestive system without too much of an issue. But it's really a warning that certain magnets, battery cells as well, can pose a far more dangerous prospect. So to discuss this in a little bit more depth, we're joined now by Dr. Safina Kairani. She is a consultant in pediatric otolaryngology. She's a head and neck surgeon, and I'm going to apologize straight off the bat for my inability to say that word. Good morning, Dr. Safina.
Good morning.
Thanks for joining us. Can you help me pronounce that correctly?
Don't worry, it took me time as well. It's otolaryngology. I think we're commonly known as ear, nose, and throat surgeons.
Okay, perfect. Tell us a little bit as we talk about this. Why do you think we're seeing more cases now when it comes to choking in children?
Well, it's an interesting question. I think if you take a step back and look at what predisposes a child to choking, it tends to be the children that are, less than 3 years of age. They explore the world with their mouth. They love to be curious. And with the COVID pandemic, I think children and families were spending even more time at home. So, of course, the little ones, they had more opportunity to explore, discover shiny objects that might pique their curiosity. And next thing you know, it goes in their mouth. And they may not have the oromotor skills to manage it, in which case it can get choked, get lodged in their throat or their airway.
And this is something that's been happening for a long time, but why is it extra concerning at the moment with the different types of objects that they can be consuming?
Well, this is exactly the issue that we're facing. So certainly there's been an increased number of children that have been playing with button batteries, but also those little magnetic balls that are so dangerous. In fact, if you look at last year, with the number of cases of children that were admitted in hospital for button batteries or magnetic balls ingestions, already we have that same number of cases in the first half of 2022. They're just so dangerous. They're more prominent. And even the magnetic balls can lead to abdominal surgery from bowel perforations. And the button batteries being lodged in the esophagus, which is quite thin in children and close to great vessels, that it actually can cause some severe and in some cases very catastrophic bleeding.
And in addition to sort of the shape, you've mentioned there batteries, which obviously could perhaps leak, I suppose, or have sort of different properties that can make them extra dangerous. And the magnetic balls, I mean, what about it being magnetic as well adds to that problem?
Well, precisely, that's the issue. So the batteries themselves, they have chemicals that can burn holes through the esophagus, especially in these young ones, like I said, to the big vessels. And with the magnetic balls, if it's one individual ball, theoretically it could pass. But the issue is if you have two, and if they're in different places in the intestine, they magnetize together and can cause a perforation. And then it becomes a true surgical emergency.
That's really frightening. And I think for parents out there who are listening, give us a sense of when they should head to the hospital. Because, you know, you were talking about how kids are at home now a little bit more, and you've only got so many sets of eyes to keep watch on them. So if you haven't really seen something happen or you're not really aware of what they've popped into their mouth, how do you know when you should be concerned and you should be rushing them off to a doctor versus just, you know, letting it pass through as we typically do see?
Well, that's a really good question. You can't always be observing them, but if you see them drooling, choking, coughing, hoarse voice, respiratory distress, perhaps they put something in their mouth that's gone in their windpipe towards their lungs. Or alternatively, maybe they're having difficulty swallowing, again, drooling, chest pain, and they've been playing with little toys, and perhaps there's something in their food pipe, in their esophagus. But regardless, it truly is an emergency. And if that happens, don't let your child eat or drink. Don't try and induce any vomiting. Just immediately, get attention. At Al Jalila Children's, we're very fortunate. We have an established protocol to really urgently get the children to the operating room if they need it, because we have a phrase in the button battery ingestion world that, every minute counts to make that difference.
In terms of just having these objects out and accessible to kids in the first place, what do parents need to know about having things laid out or having them out and about, and how dangerous that is?
Well, that's right. So trying to keep these toys and choking hazards such as coins, buttons, some of those little Lego pieces, I know I fished them out myself, away from the children. Follow the age recommendations on packaging. Trying to avoid giving children less than the age of 4 nuts, popcorn seeds. And also when it comes to cutting their food in terms of airway choking, try and cut the round things like grapes in a lengthwise direction. And of course, avoid running around and playing while you're eating. And in terms of the button battery, which honestly is a really dangerous risk, we just need to be so vigilant with the button batteries, especially not leaving them loose around the house, dispose of them properly, and also really securely fasten the battery compartment after you replace a button battery.